Hello, Professor Mera and my old classmate. This is Veerpal Uppal. Currently my rotation with Dr. Hans Yu. He's OB-GYN specialist and his location U Medical Group at Brimhall. So today I'm going to represent soap note on the uterine fibroids. I have patient 65 years, Hispanic. His date of birth, her date of birth May 9, 1959. Insurance Medicaid. She was married, but right now she's single. So her chief complaint is heavy and regular menstrual bleeding and blooding after menopause. She was 65 old Hispanic females and complains of pelvic and pressure heavy and longer menstrual bleeding coming every 2 weeks and bloating. According to ED, she has been experiencing increasingly heavy frequent for more to menses for 2 to 3 months after menopause. The patient also reported that her last flow was painful, especially in the morning. Additionally, ED noted that she has been experiencing pelvic pressure bloating in the few days before and start of menses, but is slightly relieved after the menses. Due to pelvic pain and bloating, ED also noted that her appetite and eating have been affected. So her past medical history is back problems since age 54 and mitral valve prolapse since age 50, hyperlipidemia at 39 and stomach ulcers is 22. So the flu vaccine was done 3 months ago and mammogram and pap smear was done 6 months ago and 6 months ago, and the last dose of HPV vaccine was 24. No surgery 3 times. She was hospitalized during the C-sections. So her pregnancy starts menopause for women, gravida 3, para 3, and currently not sexually active and no any allergies. She's taking metoprolol 25 milligram for mitral valve prolapse, and she's on Protonix BID, and she's on Crestor for hyperlipidemia and Norco for back pain, QID, and Zytec. So for family history, ED father aged 84, he is still alive and he has a history of hypertension and diabetes, and her mother 77 with hypertension. Maternal grandmother died at 81 with diabetes and PCOS, and maternal grandfather died at with type 2 diabetes. Paternal grandfather died age 63 and paternal grandmother died age 73 with no underlying condition. Social history: she was nursed Bakersfield Memorial Hospital. She is the third born in the family. There was raised alongside her siblings by both parents in safe neighborhood. She currently lives alone nearby town. She divorced her husband because he was drug addicted, and she had to take care of her 3 children alone. The children were all married and their homes, but frequently visit her on weekends and during the public holidays. She was not sexually active and she was not using contraceptive. She's not using any alcohol, smoking, and drugs. Her diet is very balanced, and her house manager and engaged in physical activities. Ross, she is report night sweat, night sweat, fatigue, general body weakness, and change in sleep, but deny chills, fever, and other complaint. So eyes, she's using corrective glasses. So blurring, eye dryness, and discharge or redness. So ear, nose, mouth, throat, like denies any hearing problems and wax production, denies itching, sense of smell, and any pain, running nose, denies oral sores, oral sores and bad smells, any dental problems and voice changes, cardiovascular. She denies chest discomfort, chest pressure, and any pain. She denies wheezing, gastrointestinal wise. She denies nausea, vomiting, gentry, and gynecology. She denies incontinence and any dysuria, and uh, and but reports increased urine urgency, frequency, heavy and frequent menstrual period, and pelvic pain. And she was not sexually active. Muscle skeleton wise, she denies any limitation, range of motion, and joint stiffness. Neurological, she denies any numbness. Psychiatric wise, she denies any anxiety and depression. In endocrine, hematological, and lymphatic, denies any swollen glands. Increased cold heat intolerance and increased hunger thirst, but reports increased she denies increased cold heat intolerance and increased hunger, but reports increased sweat nights. The objective vital sign: heart rate is 78, blood pressure 120/76, temperature 96.9, respiratory 23, saturation 98.8, height 5.4, weight 138, and BMI 23.6. Labs and X-ray and showing CBC hemoglobin 9.6, thyroid function test TSH level 3.2, and free T4 level 1.4. Pelvic exam: irregular shape, uterus feelings are larger than normal. Pelvic in trans-abdominal and trans-vaginal ultrasound report: multiple sublunar and intramural uterine fibroids, normal thickness of endometrial stripe, and normal sonographic appearance of both ovaries, normal cul-de-sac with no mass or fluid. Physical exam: she is 65 years old, Hispanic, well groomed, well alert oriented, and she's looking her stated as skin is normal, and her head is normal, no scar, eyes clear sclera and conjunctiva white, polar hearing, and intact, external ear canals clear with no blockage, and patient septum midline and no signs of inflammation noted. Neck range of motion appropriate, musculoskeleton, her strength 5/5, and full range of motion. Cardiovascular, regular heart rate and rhythm with abnormal capillary riffles but no gallops or clicks heard on auscultation. Respiratory wise, breathing rate, no cracks, no wheezing. Gastrointestinal wise, abdomen is soft but no tender was noted. Bowel sound present. Genitoury, the skin color of the external genitalia is consistent with general pigmentation, no vulvar lesion or observed. Vaginal was arcuate and pink with the nullipress cervix from the by manual exam. The uterus anteverted and placed behind non-distant bladder, but regularity in the shape and feeling larger than normal and tender to palpation over. Noted ovaries are non-palpable. Neurological, stable, balance, intact cranial nerves, lymphatic, no tender lymph nodes. Assessment: differential diagnosis: uterine fibroids because of the heavy, longer, more frequent and painful periods coming every 2 weeks and lasting 7 to 10 days. Other symptoms report uterine fibroid include pelvic pain and pressure, frequent urination, growing stomach area due to bloating, lower back pain, and pain during sex. According to Yang, uterine fibroids are often asymptomatic and non-cancerous growth by years, but may present with the symptoms such as menstrual period that are abnormally long, heavy menstrual bleeding, lower back pain, pelvic pain, difficulty during urination, frequent urination. So another is endometriosis is probably diagnosed in the EK, supported by the patient complaints of pelvic pain, pain during sex, and heavy, longer, more frequent painful period. Endometriosis often refer to outward growth of the tissue lining the uterus in the fallopian tubes, ovaries, and pelvic organs. Who was 3 children, and in her post-menopause stage. Endometriosis is often common in the reproductive stage of women and associated with infertility. Ultrasound report also rules out a possible diagnosis of endometriosis because the absence of large clumps of tissue and scarring that are likely signs of endometriosis. And endometrial hyperplasia is another probable diagnosis, supported by the patient complaints of heavy and longer, frequent and painful, becoming maybe 2 weeks using sanitary bad. And additionally, transvaginal ultrasound shows endometrial thickness of 4 mm, which is within the normal range of post-menopause women, thus ruling out possible diagnosis for endometrial hyperplasia. So diagnosis is uterine fibroids. Plan diagnosed an MRI test to show the more detail, the size and location of the fibroids. Endometrial biopsy to rule out possible cancer or hyperplasia. Treatment: there is no single treatment for uterine fibroids, but the most treatment option targets symptoms. In the case of the patient, non-steroid anti-inflammatory such as naproxen 440 mg every 8 to 12 hours and elevate pain recommended. Secondary gonadotropin releasing hormone again such as leuprone 7.5 mg IM monthly is recommended to block the production of progesterone and estrogen, stop menstrual period and shrink fibroids. Birth control contraceptives such as progesterone releasing intrauterine devices can be used in the case of ED to relieve heavy, frequent, and more bleeding by a patient. If hormonal contraceptives do not reduce heavy bleeding, non-hormonal medication take tranexamic acid can be given easy menstrual period. Non-invasive and minimal invasive procedures like uterine or arterial embolization can be applied where medication have failed to reduce heavy bleeding and shrinking of the fibroids. Surgical procedures to remove the fibroid can be alternative treatment option. Education, patient education to condition cause and ensure the uterine fibroids are non-cancerous is important to minimize patient anxiety. Secondly, let the patient know that fibroids are common, affecting approximately 80% of the women in their lifetimes. So follow up in 2 weeks, develop more comprehensive treatment plan after getting in MRI scan report and biopsy findings. So my for the fighting and so I have a question. So I'm going to explain which of gene vaccine caring process were considered with this patient. In this case, several of gene vaccine caring process were integrated patient care plan. First one, developing a caring relationship by demonstrating emphasize through patient education mm, about trying for brides and treatment option, empowering patient and participate in their care. Second one of developing a caring relationship by demonstrating empathy and attentiveness to the patient concern. Third, cultural consideration were addressed to provide a supportive, protective and corrective environment and ensure that care was delivered aligned with the patient beliefs and values. Lastly, the care plan aimed to assist in gratifying the patient human needs by addressing physical discomfort and emotional and physiological well-being. This for fostering a holistic approach to the healthcare delivery. In what was my care of this patient representative of holistic approach. My care of the patient impacts a holistic approach by addressing physical, emotion, and social factors, respecting culture, consideration, empowering the patient through education, collaborating across disciplines, and promoting wellness and prevention. Thank you.